Hey everybody, Dr. Mork here again. So I promised you last time that today we were going to talk about how to find a therapist. But first, I feel like I should probably explain what some of that alphabet soup is at the end of some therapists' names. First of all, you have the psychiatrist, who is an MD. They're a medical doctor and they specialize in the treatment of mental illnesses using medication. So if you have symptoms that are physical related to mental illness, like appetite changes or sleep changes, energy changes or fatigue, a psychiatrist might be the best place to start. As an aside, if you are currently on a medication for the treatment of depression or an anxiety disorder or schizophrenia or bipolar disorder, for example, and you're feeling good, stay on the medication. Don't go off of it. It means it's working. You shouldn't go off medication unless you are in direct conversation with your psychiatrist. Similarly, if you are on a medication and the symptoms are coming back and it doesn't seem to be working anymore, go back and try a different medication. There are so many medications to choose from. In conversation with your psychiatrist, you should find one that's going to work. So you have the psychiatrist who is an MD. Next, you have the psychologist. A psychologist has their doctorate in psychology, so a PhD or a PsyD, and they specialize in the assessment, diagnosis, and treatment of major mental illnesses. And so they will provide very intentional, structured therapeutic interventions to treat mental illness. However, you might not think you have a mental illness. You might be going through something else and it's not depression or anxiety, but you really feel like you should talk about it with somebody. An LPC might be a good fit for you. An LPC is somebody who has a master's degree in counseling or psychology, and they have been licensed to practice by the state. So they have had thousands of supervised hours of practice and are very skilled in working through a number of different situations and disorders and are very skilled in counseling. Then you have a master's in social work, an MSW, and that's a person who is not only trained in counseling, but they take a bit more holistic approach to counseling, and so they will look at also the academic functioning, work functioning, family situation, and community that the person lives in as part of their counseling approach. And then finally, if you are dealing with anything related to marriage, if you're going through a tough time with your spouse or your family is in conflict or you're getting remarried and you're blending a family, a licensed marriage and family therapist, an LMFT, might be a good choice for you, and they specialize strictly in working with families and couples. So how do you find a therapist? Now that you know what these letters stand for, my best advice is to ask around. Word of mouth is the very best referral. See who your family members have gone to see, or ask around at your church or at work. Don't be ashamed about asking. Let's undo that stigma right now. Word of mouth is really a good place to start. A second option is if you're living in a larger town or city and they have a mental health clinic, you can call and talk to their intake specialist, and after hearing about your presenting problem and the issues you would like to work on, and if you have any preferences regarding the age or sex of the therapist, they will put you with a person they think might be a good fit for you. My final piece of advice before we end is when you are ready to make that appointment, try on that therapist for a good fit. I mean, for goodness sakes, we try on shoes before we buy them. It's probably a good idea to try on a therapist to make sure that you two will work well together. If it's not a good fit, try on another until you find somebody that you can work with and work with well for a long time. I'm Dr. Mork. I hope you found this valuable. By the way, don't forget to laugh. I'll talk to you soon.